Hello, hi, Dr. Erica here, pharmd. Thank you for joining me on today. I'm going to talk about foot care and also lower leg care as well. The lower extremity of the body. Yes, we do have to take important because they're used for traveling, for walking, for exercising, for standing, for mobility. So we do want to make sure that our feet are properly taken care of. And that includes patients who are dealing with diabetes, patients who may be dealing with nerve ending sensations, also those patients who might have had some sort of toe amputation or a fungal infection or bacterial infection. So do be aware that it is very important that foot care and lower extremity care is in place. I've been a pharmacist for close to 10 years. I'm a pharmd, and I have seen in clinical settings patients who've had lower extremity issues. And so I thought it was very important that I present some products on this particular chat. So before we get started, please subscribe, please like and share with others that you may feel may benefit from this particular video. Also, visit my website, themillenniumpharmacy.com as well. All right, so first I want to talk about fungal care. Fungal care can happen most likely when there's moisture, extra moisture within the shoe or in the under the foot or between the toes, and also where there might not be adequate drying after washing of the feet. So we do want to make sure we're washing and drying properly as well to remove all moisture. And after athletic activities, that we're washing thoroughly and also drying thoroughly. And while we're doing athletic activities, there is ointments as well as powders that can be applied to the toe to make sure that drying and stays in place. And I'll go over that as well. There is a product called Tenactin that cures most athletic feet fungal infections. Can you see it here? Oh, right. And the active ingredient is tolnactate 1%. Okay, prevents athletic foot with daily use, relieves itching, burning, and cracking. Okay, and it says wash affected area and dry thoroughly. Apply a thin layer over the affected area twice a day, morning and night. Okay, up to 4 weeks. So after 4 weeks, see a doctor for something prescribed. Okay, and it says prevents and cures most athletic feet situations. Okay. Then I have another antifungal, which uses zinc undesolinate, 20%, and udesolinic acid, 5%. Okay, and in the picture there, you can see the fungus that is accumulated under the toenail, causing the yellowish, brownish color. And then you can see in this picture, after treatment, how well it's been cleared. That's a big difference. So fungus is really prevalent and can cause discoloration, discomfort, as well as itching and burning. So in order to prevent that, there's a menthol powder that can be used to help dry and soothe and cool the skin. It comes in a blue container, and it is for athletic feet discomfort. And it is over the counter, and the active ingredient is menthol. Menthol, and it's a powder form. Okay, so do keep that in mind as well. And for those who are dealing with dry, rough, cracked soles of the feet, or just dry and non-moist skin along the arch of the feet or the ball of the feet. Petrolatum is really good. After washing and drying, apply petrolatum. Aquaphor is a good product. It has a healing ointment for cracked, dry feet. And the active ingredient is petrolatum 41 milligram, skin protectant. And it's mainly a first aid item. So you can apply it as needed and then resort to maybe a Cetaphil or a CeraVe lotion that you can use around the clock after the healing effect here. Okay, and that's Aquaphor petrolatum, and I do recommend it for the foot for healing purposes. Okay. Now, a lot of people do experience corns and calluses and bunions. Dr. Scholl's is a brand that I can recommend for you. Dr. Scholl's carries products that are cushions that can be applied and worn throughout the day to ensure that irritation does not occur on the bunions or around the certain feet areas of the feet. So do be aware that those products are out there, and I have some to show you. So I do want to show you bunion cushion, and it's an all-day cushion pain relief, and it's going to help with it says it's thin and it's flexible, and it's going to help with, I have the pricing on there, I'll cover that, but it's going to help with that bunion that is on the inner part of the foot. As you can see the picture here. And I would highly recommend it if you think that you may be dealing with potential bunion. And this particular pack has 5 cushions to prevent shoe friction and pressure. Okay. And it says it's nearly discreet and it is nearly invisible. Remove the backing film and smooth down adhesive edge to the skin. Okay. And then you want, before applying this particular one, make sure again the foot is washed thoroughly dry and no oils or cream are on the foot. Then you would apply this one. Okay, that is for bunion, Dr. Scholl's. Okay. And then I have for corns as well. Corn removal. And it has the salicylic acid, which is medicinal. So it is medicated product to help with pain and discomfort. So, and these products are by Bayer, products of Dr. Scholl's. This is for calluses. Okay. For those of you who do not, who may be wondering what a callus is, it is going to be at the very bottom. Look at that picture there. At the very bottom of the foot, right in the step of the foot. That is called callus, okay? Now the callus can occur, also the corn can occur, as you can see in the picture, where my finger is there. For those who have corns, they usually come from wearing shoes that might be slim or narrow in structure, or shoes that may have a strap that sits right on the small toe and cause that irritation. That would be a corn. Okay, so do consider these. They are reasonable price, over the counter as well. I do recommend them, and I have not had to use them personally because I am very particular about my feet and the way I feel when I'm walking. If there's any sort of discomfort, I was watching another video, and there are so many other women that agree with me. If there's any amount of discomfort, I will not wear the shoe, no matter how cute, how pretty. I will not wear this shoe because I don't want to have to deal with the tenderness of growing corns, because those corns, all of those calluses, they begin to harden. And then when they begin to harden, they'll have to be removed, okay, through a professional. All right, so the last but not least, I have lower leg extremity products. And these are for nerve pain, diabetic nerve pain as well. And also those who may not have diabetes can also use this cream and apply it. It's odorless. I'll show it to you here. By Magnalife, odorless and no mineral oils or petrolatum. But it has active ingredient dimethicone 1%, which is skin protectant. Okay, and this is for dry, scaly skin and cracked heels with irritation. So if you're dealing with I'm sorry. Okay. Really dry skin, the Aquaphor is good for healing. And then this is also good for dryness of the skin on the heel, on all along the foot. And then for the leg cramping is when there's not enough sodium chloride or not enough salt that is getting into the muscle, that's causing the muscle to not properly function. So leg cramping will occur. Usually you can take a leg cramp reliever, which has all natural ingredients, relaxes calf and foot cramps. Okay, and it has quick dissolving tablets, and it is all natural again from by Highlands. I'm going to take the price off, but I do have this for sale at my on my website. So do visit my website. Okay. And directions are for adults and those who are older than 12. Dissolve 2 to 3 tablets under the tongue every 4 hours if needed. I've never personally tried it myself for pain in joints, calves, feet, legs, and leg pain as well. I've never tried it myself, but I've suggested it to other patients who come in and ask for a remedy or some sort of suggestion. Also, Tylenol will also work for leg cramps. Ibuprofen, your Aleve or your NSAID class of medications will also work for leg cramps. The diabetic dry skin relief will help with dry skin and help if you would like take this particular cream and massage it into the leg, into the feet, into the lower calves, that might help with reducing cramps as well and getting restoration back into the muscle. So I would do recommend that. Also, there is Doan's nerve pain cream. Doan's is in my other video. It's spelled DOANS. Do visit the other video that I have about pain relief. And Doan's pain relief is for nerve pain, in particular back nerve pain as well. So that is a good suggestion, I believe. So if you have any questions or comments, that's all I have for this particular video to share with you about foot care, antifungal, calluses, bunions, and corns, and then also dry, rough skin that you may be feeling at times. There's healing petrolatum, and then there's diabetic cream for rough skin as well. And also for leg cramping, there is a remedy for it, and also a good massage and a good um, another product that I want to recommend is Epsom salt. Epsom salt is good for muscle relaxation as well. Try Epsom salt, if I may suggest, as a healthcare professional. Try Epsom salt. Epsom salt will help to relax the muscle in warm water and get rid of any irritation and pain. So do take that suggestion, okay? Thank you for joining me. I hope to see you all on the next video. Please like, share, and subscribe. I am hoping to get 1K subscribers to this particular channel. So please, please, please like, share, and subscribe. Like, share, and subscribe. If there's nothing else, I'm going to sign off, and I am Dr. Erica. Thank you for joining me. Have a blessed day. Peace.